go because it's
Yes.
1:15. So we will end our recess, and we are back now with Stacy from Children's Cove.
I'm going to suggest as we start that this seems to be pretty straightforward. I think we know what the mission is. And the only real question that I had was we support Martha's Vineyard, and I'm wondering if we get money from the state for that.
Technically, no. We support Martha's Vineyard and Nantucket, but the money that we do get coming in is for Barnstable County only, is how I took it when we... But we've always supported the island.
That's not my understanding. My understanding.
That was my understanding when I came
Right.
here.
The grant is for the same coordinator to provide services to Barnstable Town to keep in the islands.
Okay. So,
I'm sorry, before we get started here, could you identify yourself?
Stacey Gallagher from Children's Cove.
Thank you.
That's not my understanding.
Okay. We support the islands either way.
Okay, well, if we're paying Barnstable County money for something and not getting reimbursement for it, I think we need to know that, as we go forward, because we certainly, it's certainly something that we're responsible for.
I want to make sure that it states that in the contract.
When on your goals, just because I think it's helpful to know, on the third page, you talk about exploring an interest in a mentor program. Can you just talk a little bit about that?
I actually worked on this with Kate, and that was something that she had suggested we work on. I think she had put it out to the county as a whole to work on a mentorship program. I'm personally doing one in a leadership group, but something through the county that Children's Cove could be involved in with the county and doing some kind of mentoring.
Mentoring of the programs?
Yeah, the programs.
Okay.
Yeah.
So you're not it's not recruiting individual mentors?
No, it's within the county departments, is what she had suggested to me.
And then you made another comment further on in your goals about finalizing a fundraising database. That's kind of interesting.
That's the next page.
The next page. The last one on the next page in terms of tasks.
That was a task area you're going
Right,
to
that's
increase.
specific to Children's Cove. We brought in a fundraising database that we're utilizing to do our own and for our Friends of account. So we have a database that we're constantly putting into and finalizing.
That's a really good idea.
Yeah, and it's helping to streamline a lot of the stuff that we've been doing, but we're still adding to it. We got it last year, and we're still trying to really...
There were two questions that had come up. Who serves on the board now?
I do.
Okay. There are two questions with regard to insurance reimbursement from referrals, as well as what one of the goals was extended forensic interview, additional training of internal staff. And I was wondering what involvement the DA had as far as supporting that, because that this was started as an adjunct of the district attorney, and I'm wondering, since you're talking about extending forensic interviews, and that is specifically a law enforcement activity, as to how much support you're getting for that.
The extended forensic interview is a specific interview. It's not the typical forensic interview. The extended forensic interview is the second half of a forensic interview if you don't get much information that we can go into and do an extended 6-week. It's not clinical, it's not therapeutic, it's an investigative piece. And we have that right now, but I'm extending it to other staff because I don't want it to be part of the clinical. Tamara's been doing it right now. Right now where I am with that is that we have trained people. I'm actually trained as doing backup as well. Beth, who is our training and outreach coordinator, is trained to do that. So right now the goal is we're just tweaking what's going to happen, but from here on out she'll be doing them. And what it will do is ease up Tamara's workload because our clinical referrals are double what they were last year. So it's alleviating that need to really hire a second clinical person is what I really need to do. But in order to alleviate work from Tamara, I needed to do that. So the second piece of that, so funding for that, we don't get any funding from the DA's office for that. There's really no additional funding that's needed for that besides the training which we got through our regional, Northeast regional people. Other than that, those services are free of charge.
There is a concern that the implication of being involved in the forensic piece suggests that you would be qualified to testify.
Mhm.
Okay, and that the testifying is a burden in terms of putting people, out there to give this, to give testimony, which
Right.
which is important.
Right.
But there's, the issue for me is there's a confidentiality that goes with a clinical relationship,
Mhm.
and there's a responsibility of law enforcement to share that information with, with the courts, especially when prosecution takes place.
Yeah.
How do you, how do you balance those two things?
We
with
don't.
regard
We
to-
don't. The information that comes out from clinical is, if they want the information in court, the DA has been helpful with helping with that, and we only put out what is requested by subpoena. For the investigative piece, our law enforcement has been very cooperative in sharing that information. We have a great relationship with all the law enforcement departments on the Cave, and we don't have an issue with sharing that information. We actually get updates from the DA's office as to where cases are in the court system, and if we do have to testify in court, we're pulled forth. We don't testify a lot in court, besides Tamara testifying to her clinical experiences with the cases. The only reason we would really be pulled into court is potentially for the extended forensic interview, which is a longer session of the forensic interview. But typically they try to keep us out of court, because if we were in court all the time for forensic interviews, we'd be there all the time. And throughout the nation, they actually hire forensic interviewers who are just in court all day, and then they have interviewers who interview, which is ridiculous from what I think. But the only thing we would have to testify in court to, because we don't keep any physical records of the forensic interview, just so you know, is that, yes, we did the interview. I can't tell you any more information because we don't have a record of it. That's something that you have to get from law enforcement. So that sharing of information is really important in that respect, because we don't keep those records, which allows us to stay out of court and continue what we're doing.
Okay, and then finally, the insurance support for funding. If you get a referral,
Yeah.
and I've talked to you about this before.
Yeah, and that's something I put on there, I think, because it's been thrown around with the previous commissioners. And I know Mark had talked about it, about billing for insurance. I don't know if that's ever going to be anything that we can do. I don't know how I feel about it. I don't know if it's something we can ever do, but I put it on there because I know it's been talked about.
I would imagine that if you do bill through insurance, then there's a record. There is a.
But that's for clinical purposes
it's
only,
just-
and
so it
there's a
doesn't-
record
so
for
there's not
clinical
specific-
anyway.
Okay, but on the insurance, it's not specific that it's clinical in
No.
your gut
Yes,
relationship
it
to.
is.
It's just billing for mental health services.
Mental
just
health
as if
services.
you went
It
to a
doesn't
psychologist.
state that it's
No,
through some sort of what that mental health
Right,
is. Okay.
right. So it's
So-
already out there. I mean, it's not.
Because I would see the hesitancy in
Right.
disclosing that this is something that's now on a blemish of a family. I mean, people can.
Right, and we try to keep confidentiality as much as possible.
Right,
Unfortunately, that attorneys
This
know
is-
we exist and know we're out there. But the billing of mental health services, I think Mark's statements before is that it would cost us more. I don't know the ins and outs of it, but it's definitely something I put on there because I know it was something that the commissioners had discussed previously. So
And again, I put you in touch with, I brought Steve Jochum in to find out, because I found out that we were getting referrals,
Right.
and the agency that was referring to us was getting paid for making that referral, but we weren't getting, any money for doing the
right,
work.
and nothing ever came out of that, believe it or not. Steve is still sitting on the board. We had talked about that they get specific grants to support it, unfortunately, but when we get a referral from DMH, we don't get any financial assistance from them at all.
Well, I would hope you to
As a partner, yeah.
to keep up,
I-
reminding him that he has more money than we do.
Yeah, I know.
Okay, let's move to your budget.
Okay.
I'm just as an observation, your salary line is considerably less than the current year, but yet your bottom line is considerably more than the current year.
9%,
So
yeah.
maybe you can talk about what the shift in your planning is for the coming year.
And I don't have the previous. I don't know what the previous year's total was, but nothing has
Change.
changed for salaries.
So maybe this, okay.
well, it was 300,000 and you've gone down to 255.
Yeah, I don't know where that is.
You'd have to ask Mark.
So it's a
Yeah, we'll have to
50% fall.
Yeah, I don't know where
It
that's
could
coming
be
from.
something about that $65,000.
I'm sure.
We came in and out in different ways last
Yeah.
year.
Yeah,
Yeah, they
a-
had
it's a mess.
65,000 and another element. If you add those back, you're actually increasing those.
I'll look into that too.
I'll ask Mark to explain.
But there haven't been any changes
Okay.
for salary.
Everything is still
Yep,
the same.
everything's still the same.
Staff levels. are
How
still the
about
Yeah.
program-wise? Any changes?
No,
program-
there's no changes, and the situation with the budget with DCF is basically, I don't know. I don't know if we're going to get, I'm actually submitting letters right now to the delegation about hopefully reinstating the 130 that we have, and not just the 65, but I don't even know if we're going to get the 65. So I think we're going to be stuck in that same position. We won't know till the very end. So I will be submitting, as I always do. And then the 80,000 for the SAIN, SAIN, which we should be getting. There shouldn't be any cuts in that. And then the 20,000 from the DA's office, the DA discretionary fund, I'm asking to support too. I think that's going to be safe too. That's kind of depends on what the DA wants to do with that money. And I've had conversations with him, and that supports our conference. So I think we're pretty safe on that. But it's really the 130.
You get $10,000 for office supplies.
I put that in every year. That can be moved around. We'll probably use about half of that.
What about the miscellaneous contractual?
Miscellaneous contractual is our copier. Miscellaneous contractual.
You have $15,000 in for that.
Oh, that's our advertising. That is our outside marketing agency, as well as our supervision for Tamara, outside supervision for her, and our alarm company.
Did you not get that approved last year?
We did not get it approved, and then we got the 65 from the county, and that's why it's high right now. So we're actually using that money. We went in front of the assembly to use that for our awareness campaign, which is what we're using it for.
Right, and because the 2010 is original budgets, it usually doesn't reflect supplementals, which is what the 65 came in as. That
Right.
got reinstated.
Right.
Right.
Oh, okay, so that's the supplemental.
So the supplemental isn't
For
reflected.
this
in
year isn't reflected in here.
No.
So you could add 65 to the bottom line for this year,
which would bring it
which
pretty
would
much
bring
to
it about what the same.
If I may, you're saying that your referrals are twice as what they were. So obviously, some of your outreach and advertising has taken hold. The bad news is that there's twice as many referrals.
Right.
How many of those referrals actually go through and you find cause? A percentage. Is there a percentage of?
In the prosecutor's office?
Yeah.
Do
you know?
No, they will tell you. It's tough. It's tough because it takes so long. We don't have the numbers for the cases.
Right.
I can tell you that the cases that we've had in the last half year are nowhere near ending. Brian will tell you that there's 95% conviction rate when they do come in, but there's no way to really tell what cases are picked up for a final cost.
So you're made a referral, and you basically sort of investigate. You kind of go through the motions and say, yes, this did occur or it didn't occur, and then you refer it on to the.
We're not saying that. We're
Okay.
kind of doing the work for them.
Yeah.
We're doing the. We can't say if it happened or not.
Right.
We can tell you from experience. If I were in court, I can say from experience.
Yes.
Um,
The indications.
The indication is that this child is potentially
Right.
telling the truth.
Yes. Okay.
But other than that, we're talking for the police that don't need to talk from
Right.
because we are experts in that field. And then from there, the police will do their investigation. Will continue with any further investigation if there's evidence that needs to be collected, that kind of thing. DCF will continue with their investigation, and then it will be sent over to the DA's office, and they'll make a decision whether to charge or not. But it's based on the investigator's report.
And is that the case?
And ours.
Is the majority? Are there cases that come through and you say, I think they're misreading what's going on?
Oh, absolutely. Yeah, absolutely. I think there's a misconception out there that children lie about this. It's less than 1% actually do that, but children can't continuously carry a lie, and we usually catch them if they do. But definitely been an increase in younger children, child on child, and a lot of teenagers lately, and we're
Really? Teenagers?
yeah, internet stuff, Craigslist, Facebook, meeting up.
Being preyed upon or praying?
Preyed upon, meeting, people coming down from Boston and meeting on the Cape, and then something happens, those kind of things. But the internet's definitely increasing the teenage population for us. So a lot of the awareness you're going to be seeing is going to be based on internet stuff. And we have a lot happening in April for our awareness campaign, the pinwheels again, our radio ads, hopefully you've heard them. We're coming out with some print ads that will be really effective too. And talking about the islands too, with the additional money that we have, we're reaching out to the islands, so we're doing NVY. We're going to be in some of their newspapers specifically, whereas we kind of focused on the mainland stuff before and hoping that it would reach the islands.
Is there any connection between the suicide prevention activities that are going on and these kids that are being attacked?
Yeah, I actually contacted them to let them know that I would love to sit on their committee, because I think a lot of it goes hand in hand.
How did they respond?
Yeah. I've just been out on leave, so I'm hoping to jump back into those meetings.
We're meeting tomorrow, by the way.
Yeah, I know, I'm not here. I think there's a huge connection between that. I think that, anytime I see something like that, it's, what happened to that child. It's always in the back of our head when something happens like that. It's what happened to that child.
When is your next board meeting?
March.
Oh, it is
First
already
Monday in March.
Okay, first
Yeah.
Monday.
Okay, since I usually go to those suicide prevention meetings, is there anything you want me to talk about as far as this
No,
connection?
I haven't been, so I want to definitely introduce myself and get
Okay.
affiliated with that, because even Ben Caswell, who's from Wendell Marketing, who sits on that, we've been discussing it, and I think we both have feelings that it does go hand in hand, and we definitely, from Children's Cove, have something to offer.
Beth Albert is the coordinator for the.
Yeah, I
community.
asked Beth about it, so.
Actually, we have had somebody from Children's Cove come to.
Oh, Beth went to it when I was out on leave. Yeah, she took my place, so.
If she continues to go, I think that would cover it.
Yeah,
Yeah, great.
I think it's important, so.
Any other comments or questions?
The only thing is that when we go through this, you're going to get money and we're not going to get money, and then we go through this over there.
Yeah.
Well, we'll go through, we'll have to revisit
Yeah.
this again. We'll
Yeah.
need to talk with Mark about it too, because of the accounting here.
Right, and it might be a situation again where we get it and they pull it, and
Right.
we get it back and they
Right.
pull it again, so we never know what's going to happen with that specific money.
What we were trying to do is protect the money for the purpose it was intended for,
Right.
rather than letting it slip into the general fund, which when it does that, it sort of disappears.
I know.
I'm good.
Okay, I'm good? You're
You
good?
too, good.
Thank you,
Great.
Stacy, very much.
Now, all he has, and just so you know, I've hand this out for you next week, all Mark has, and you should have received this electronically, for revenue next year, is the $80,346. So he's only, in the budget that he's put together, he's only counting on the 80 grand from St.
On the what? On the 80 grand for sane?
For St., which is,
So he's not submitting,
he doesn't have the 130,000 in here. All he has on grant contracts for the Cove is $80,346.
okay.
So if that's not, if you don't feel that's correct, then you need to speak
I know.
to him.
And I don't know if we should submit it that way or not.
So he must be planning on using county revenue for the balance.
Right.
Do you say he sent that to us?
Yes.
I will, I'll talk to him about it.
And I have copies as well.
Yeah, he did the revenue, but he said it was very preliminary.
Yep.
Yeah.
So,
I was kind of waiting for something a little more.
yeah, that's what I was waiting for too. There's something more updated. Thanks again, Stacy.
Thank you.
Yeah. Next, we will invite Beth Albert to meet with us on the Human Services Director on the Human Services budget. Oh, yeah, I had this.
We have
We're playing to this. We're in the hole. That's why I didn't want to look at it.
Yeah.
Good afternoon.
Good afternoon,
Well, Maggie,
Mrs.
if
Albert.
you have to go early for the CLC meeting, it might be an idea that if you just send somebody
Where's
over
that sign?
when it's time for the vote, so that way it can match up the amount of
Oh,
time.
you're
we
not
budget.
Uncle
I
Albert.
can't hear you. Bill.
When you have the
You're
vote,
Mrs.
send somebody over to get
Mrs.
it.
Albert. No, we won't sing that to you today.
Thank you.
Hopefully we'll be having only good things.
So how, do you want to start, or do you want us to
Well,
start
I
with
mean,
questions?
Well, before you have the goals for the
Right.
department as well as the budget. So I guess we should start with the goals.
Would you just identify yourself and what department you are?
Elizabeth Albert, Director, Department of Human Services.
Thank you.
Do you have any questions about the goals?
I just want to say that you're living up to the expectations that we had when we were looking for somebody that
And I
would
had
continue the human service activity and provide the coordination, collaboration, and communications, let's say, nexus for the county. And I see that in one of your goals is to continue that. So I think that's a good thing.
Good, thank you.
I want to ask about your task, the one to work with IT to create and maintain an interactive website. Have you had discussions with them about that, or do you know what would it take to make that happen?
Yeah, yes, we've been working on this for a while. We had an outside, a web designer,
Mhm.
so we've got our web design, and we've had many meetings with IT about the content management software we're using, and we are poised and ready to actually populate the website, and hopefully our launch date is March 1st.
Oh, that's
What
good.
I'm shooting for.
Now,
Um,
if I may, how is this all going to, I mean, I guess it's all going to stem from what we decide to do with the IT department and how we can coordinate, or does each department just go?
Well, some of the conversations I've had with the IT department are using the work that we've done as kind of a template for maybe what other department websites should look like, because we're very concerned with accessibility for people with disabilities, and so that's been incorporated into the web design and is incorporated into the content management system. We're working with the Human Rights Commission to make sure their website is compatible with and part of the county website. And that too has the accessibility features that we really need to be compliant with the ADA. And so those things, that type of technical assistance and resource, we can use any department that's updating their website.
Mm-hmm.
And we've all, what was the other part of your question?
No, I mean, I'm just looking at, I mean, I guess what we're going to be grappling with is how do we, and from what I could gather from the report, the IT report, is that each department has some components of it that have outside software, outside that has to sort of be brought in, and that is, very time consuming and labor intensive, whereas if we have the one, county server website that then we make sure that the various software that people have to use
Is compatible.
is compatible and
that
brought in,
meets-
and
complies
and
with
that's going to be a big thing that we're
complies
going to
with
have to.
accessibility
make sure.
requirements of the ADA.
Okay, well, that's the IT discussion,
Yes.
but
But we have been working closely with them over
Your
the
goals
course of months.
should not be impacted as to whether the websites are hosted on the county servers.
No.
or whether
exactly.
they're
No,
hosted-
no,
That's-
I know.
that's, you know,
Yeah.
Okay.
The rest is to get.
But I'm just trying to get things straight in my head as
It
we
is
go.
interactive because we're building in a lot of the ability to have like community bulletin boards where people can post questions. So we've had those discussions and are building that into the design of it. So even when we launch on March 1st, if we don't have all the components, we're going to be able to do that in the future. So I'm very excited.
On the second page, you talk about an H3C committee, healthy,
Happy and
Connected
healthy
Cape Cod.
eating. Yeah. Well, there's Healthy Connected Cape Cod, and then our first year project is Happy and Healthy Eating. And that is an initiative that we're just beginning with the Health and Human Service Advisory Council. Based on the data that the department's collected over the past 5 years, hunger and the need for nutritious food and the ability to afford nutritious food is a huge problem on the Cape.
Mhm.
So we really were looking for a project that everybody on the Health and Human Service Advisory Council could say it impacts the entire community, regardless of whether you're working with kids, seniors, domestic violence. Having enough access to affordable and nutritious food is something that impacts all of us. And so there's a lot of different components to that. We're working with AmeriCorps right now on the Martin Luther King Day of Service. It's actually called Hungry for Change. And so the concept and the theme this year is hunger. So we're partnering with them on that. So we're just starting this. We've gone through planning. We have our goals for the coming year. Been in touch with the nutritionist, the cooperative extension. So I see a lot of areas where there's connections with other departments and municipal health employees. I don't know the correct title of that group, but
Cape Cod Municipal Health Group.
thank you.
It occurs to me that there's a connection with the summer food
I was
program.
just going to ask
that we
that.
have.
Absolutely.
And I'm wondering whether or not that's something that we ought to ask for, lay that off to another organization. I know that Calvary Baptist, for example, runs a very similar program, and they're in the area that we were kind of supporting. I'm wondering whether or not it's time to find out whether or not we support them rather than being there ourselves.
Well, last year we did make an effort to find a sponsor for the county, and we were unsuccessful. And the summer food service program is where those sites are located is determined by the percentage of low-income students who qualify for free and reduced lunch. And so last year it was mainly Hyannis focused. We had some other pockets that we probably could have had a site in, but we didn't have sites that were willing to say use our rec center to do a site. And so like I said, we were unsuccessful in that last year. Project Bread, who does the outreach for the summer food program, has been in touch with me. They are they're always looking for someone to sponsor. At this point, nobody's come up to the plate. So that's the status of that. But it is the summer food service program is absolutely part of the whole healthy, happy eating.
When you say sponsor, are you saying sponsor as far as a site sponsoring?
No, sponsoring the program.
The program.
And then we had 4 sites last
Have we
year.
gone to like Stop and Shop or any of the large Shaws, the supermarkets that are,
To sponsor the summer food service program? No, I don't believe that's ever
or
been done.
to somehow?
You mean
there was
sponsor,
a-
we'd have them do it, operate it?
No, the sponsor, we're kind of the convener.
Right.
Right, I know that
So
we're
the money,
Not the
we-
money,
we
not the
take,
money.
We
Okay.
take care
Oh,
of
okay,
all of the
okay.
administrative.
Mhm.
We hire
Mhm.
the staff for the
Right.
open
Yeah.
sites.
No, I'm saying, but, so it would be a partner or contributor, I guess, would be.
A financial
But you don't
partner.
need that with you.
Yeah, the tough
You
part
know-
about hiring somebody is you're hiring somebody for the middle of the day.
We hired a part-time coordinator last summer, and we had site supervisors who were there from 11 to 1 every day. And I had 48 people apply for that position.
Really?
Yeah, a lot of people who
Wow.
work in food service departments want something very, very part-time during the summer. Kids who aren't able to find, there's plenty of people who, believe it or not.
There was a segment on the news the other night, I think it was on the news, where a town, either in Pennsylvania or upstate New York, I'm not sure which, every single person in that town is obese. And so finally the whole town decided to address it from just the general population to all the students in the schools. And they were showing all the different things they were doing to help residents eat healthy, lose weight through activities, recreation, all of that. It was an amazing program.
Well, that's what
An
we're,
entire
that's
town.
what
It's
we're
kind of
looking, this is, to be a county-wide initiative.
Yeah.
And that would be the ultimate goal,
Mhm.
to have this healthy and happy eating but right now we're doing the inventory of everything's out there. We don't want to create any new programs. We want to promote programs that work. There is a tremendous amount of resources, states that have done it, towns that have done it, counties that have done it. I was on the NACO website. They actually had a Robert Wood Johnson grant, which just ended. So this is the time to do it. Everybody's doing it. There's we're looking for the opportunities to collaborate and actually roll out something that is along those lines.
You know, it could be that we could participate in a way that we've got the menu. We could talk about whether or not we actually did some of the stuff in the menu as far as the food groups. You're supporting. I think it's
Well,
probably
the
high
cooperative
protein.
extension does. They have 2
Yes.
nutritionists on staff, so we absolutely want to support the work that they're doing, because they do this work. They work with the schools, they work with the preschools, they work with the senior centers. So I see a lot of opportunities to collaborate.
Mhm. On another page, under your developing joint research project with UMass,
Yes.
the number 8, you say research into MTHC. What is that?
Monitoring the human condition. That's
Oh, okay.
the name of the research that the department has done. And actually, yeah.
So, so working with the Dartmouth School of Nursing, psychology, sociology, this would be something new.
Yes, we've already started. We've had preliminary meetings with them. We've given them the data and to let them look at it and see if it's something that they could get either a graduate level or doctoral level student interested in really drilling down into the data on certain areas, because there's so much there. I mean, the department's been collecting this for 5 years. I think Warren told me there's over 4 million pieces of information. So we have all these data sets, and I'm not a statistic person, so but there's lots of work that could be done around that, the data that currently exists, and monitoring the human condition. From what I understand, and I've talked to a lot of people about this who look at what counties do as far as collecting information. Barnstable County, monitoring the human condition is really unique. There's only one other county in the whole United States that does anything on the level that we do.
Where is it?
It's in North Carolina. So it's good stuff. There's a lot there. It would be great to get into some kind of relationship with one of the institutions of higher learning to benefit. And so actually in my budget I have actually written in for, I called it an intern, but it really would be a stipend to pay a graduate student or a doctoral student to work on that.
Yeah.
And then as well, Warren is
Yeah, I noticed that. You're
transitioning. So
does that mean you're cutting your position a bit?
no,
No?
this means we're hoping that the graduate student will fill in. No, that's a full
That's an
position.
additional FTE?
That's to help kind of, the way I envision it, if it all works out, is this person would help with the transition as one staff person retiring and going down part-time, picking up the slack, and then also providing that person with the opportunity to get training in the kind of work that we do, in the hopes that they would be interested then in, we're what's the word I'm looking for? Grooming someone, I guess, would be the best way to look at it.
Successive planning.
Don't say that. Well, planning for a transition.
I'm sorry, a transition to what?
Someone that's retiring out of the department.
Warren's right now. Warren's an FTE. If Warren elects to ask to have his hours reduced, Beth would have to recommend it, and then personnel papers would come to you, and then his position would have to be competitively advertised to fill the FTE.
Right, but this person in the interim could help as
your
doing their
succession planning.
right,
Uh-huh.
and helping us plan for the kind of data that we want to collect in the future.
With the grooming thing, you have to be careful. It sounds like they've got an in.
Oh no.
No. But someone, but there is someone that has that expertise, and if it's a good match, then they can always apply.
Right.
Yep. Right. So.
Now, as you bring this up as a possibility, one of the things that I think we ought to think about is there's always a possibility of doing, contracting for professional services that actually do both the data acquisition and the data analysis piece. And one of the, if you're looking at a succession you might think about what would be, what would be the benefit of say, of adding or replacing an FTE versus, looking at a contract, let's say, designing the kinds of measurements that you want to make, and then deciding whether or not that's something that can be done on a contractual basis.
Is it a question or
Well, I just-
something
I
to
just-
look at?
When you're looking at succession, that's always because what we've talked about is, we've talked about looking at our organization to see whether, of the whole county, as to whether or not there are opportunities for consolidation of activities. And also, right now we're vertically integrated in that we have full-time employees that are actually doing the function. Is that something that could be outsourced or not? So whenever we look at that, that turning point, I think that it's fair to say that it's just my opinion, but you shouldn't automatically look at, replacement of overhead, but whether or not that's something that can be looked functionally, and then decide whether or not it can be, you basically can contract it out.
Okay.
I don't know. It's just my opinion of that.
That's, right. All right, let's move to the budget.
The professional technical services, the $50,000, is that where the where that intern resides?
Yes. And I'd like to continue, the other piece of that is, right now we are contracting out for someone to help us with the 211 project. So that money would cover the internship, the contractor to the consultant to work on the 211, and also with the Happy and Healthy Eating and the Web Clearinghouse. So the projects that we're working on to get assistance in helping the department reach our goals.
I don't see anything else significant in terms
No,
of your budget lines.
everything
They
else
look
is
pretty
pretty
much
much
the
Pretty bare
same,
bones.
other than that.
Pretty much
Pretty
the
bare
same.
bones.
Pretty bare bones, isn't it?
That was actually the only, I guess, substantial or notable increase. Everything else is either the same or just slightly different than it was last year.
Beth, just to mention, and I'll bring this to Mark so that he can address it, an intern is a salary, not a contractor. So we would have to move, it could be a temporary or part-time. Because remember, the contractors they don't use your equipment, they don't work in your office, and it sounds like your need is definitely somebody in the office using your equipment and under your direction, as opposed to, here's the project, go and get it done and give me the final product. And if it's not, then it's not really an intern.
It's the
it's a
IRS
contract.
laws.
It's the IRS laws for employees versus contractors. So think about it, and then
Okay.
Mark has time to adjust
Yeah,
it
a lot
as to
of
whether
the
it should-
I put it in that because a lot of the fine tuning, we don't really know what this is going to look like yet.
Functionally, I
And
think
there's a space
that's
issue.
something we can get
Right.
behind
Space
in
for
that,
everybody.
based upon what it would deliver. And it seems, my first impression, it has a lot of merit.
Well, interns
Yeah.
are very valuable,
Yeah.
but their interns are in a salary line item versus a contractor. So think of just
Yeah, we
let
might have
Mark know.
to
Just talking about
switch
the
Yeah, you may just
function
have to
and
get the
depending.
money up to
let's
the
say,
other.
and the outcome
Mark
that's
know.
proposed, I think, has a lot of merit to it.
Well, once you figure it out, which you prefer, I'll tell him he can work it out with you.
Okay.
Any other comments?
Well, if you do go to a line item where it's a part-time employee, you then have almost a guarantee you'll get somebody to fill it. And in the next, it may not have the support or sponsorship of the university, but you can certainly go there for a recruiting basis. I think that what I heard in your intention was that the person that would fill it would get some sort of graduate credit or credit towards, the responsibility. And I think that's possible because in other social work, you can work on the staff of, let's say, Catholic
Yep.
social
Yes,
services
we do, right.
and get credit for your supervision.
Yeah.
'cause
Did
I
our
know
internships.
Right, we did our
because my daughter
internships.
did that.
Yeah.
So,
Mhm.
But I'll find out, depending on how this moves forward, where it would be the appropriate one for it to be.
It would be, if I may just add a comment and that sort of thing. It does get tiring if you have people come in and you're just saying, "Oh, what a great job! Oh, everything's great." But I do have to say that a couple of years ago, the Human Service Department was sort of in flux, and it was a boat without a rudder. And Beth came in and really did help define the role of the Human Service Department within the county. And it really, we do not provide direct human services, social services, but she has really become a depository for information, collaboration, cooperation, and as far as the regional network, which is something that wasn't even on her plate that came on, and has been time consuming, huge amount of time, and holding the accountable line for the budget that has been given. I just have to say that you've done a phenomenal job.
Well, thank you very much.
I really do.
Maybe they could come sooner. They're not scheduled till 2:30.
I can give Darlene a call and see
Okay.
if you'd like her to come
That
back.
would be
Yeah.
great.
If she's
If
ready
she's
to have her come
she's
down.
available.
Well, I'm glad you said that because you're really the liaison to Human Services, and I didn't want to preempt you on that.
No, I
Please go
appreciate
ahead,
it.
you
But
can
I
add.
Thank
think, what I observed is that you have taken you've captured the absolute essentials of the Human Services Department, and then you've actually made it work. Some people come in and they have all the experience and the ideas and everything, but they can't put it into practice. And what I see, all that you do, it's just amazing that you get it all done. So she's absolutely right.
It is amazing, and I'm sure that somewhere in there you would have loved to have put another person in there just to give you some assistance. And
Well, and given, I'm a very practical person, and yes, I would have, but that's with the flexibility of hiring contractors or interns to kind of fill that need. I mean, I think we'll be able to get at least the goals that I've set for the coming year
Right.
underway, or hopefully maybe even completed.
It certainly
done a great job.
reinforces that, that thought that I have that Beth was one of the best hires that we've ever done.
Oh, I agree. And,
See, you get all these
we
compliments.
can't take
It
credit
just
for it,
means
but
that you
we
have to
can
do
only
more.
say that was a
We
really
certainly
good
would
decision.
we would certainly get the blame for it if it didn't
Yeah.
work out.
Right.
All right. Well, thank you.
So thanks, Beth.
No,
Thank you, Beth.
Thank you very much.